All right, this next question came from one of our viewers on Facebook. She says, when I take diet pills, my throat becomes inflamed. Now, I want to talk about diet pills a little bit afterwards, but what could this inflammation be caused by?
Well, the diet pills could be doing their job there, obviously, by causing inflammation of the throat and preventing the patient eating.
Oh my gosh.
Which is probably what she wants to do. No, I'm only kidding. But, looking at what she's saying, there are quite a few different products available on the market. So diet pills are aimed either at suppressing appetite or increasing metabolism. Two main categories, generally. The other thing that's quite important with this is to notice that after taking these pills, and it depends on whether she's taking a capsule or not, you often have a bit of indigestion or what we call dyspepsia, where you feel a bit bloated and swollen. Once the tablet hits the tummy and the acid acts upon it, and that capsule actually bursts, you often get that after burp taste in your mouth, from vitamins too sometimes.
Right.
And then you often get that unpleasant sensation of the discomfort that actually comes up. But why I'm saying that with pertaining to inflammation of the throat particularly is what we call reflux esophagitis. And that means with the acid content of the tummy, you often, and taking tablets sometimes even on an empty tummy, you then get that indigestion and you get a surge of acid up the esophagus, and it can cause a lot of damage to the inner lining of the tube, giving you the inflammation and the burn. When you lay down flat at night, the acid can also reflux and give you a sore throat and inflammation of the throat. The other thing would be to look anatomically. Is this person's throat perhaps a little bit narrowed? And is she having difficulty swallowing big tablets, that as the tablet goes down, it actually scrapes the skin at the back of the throat? A lot of people can't swallow pills.
Right.
I have many requesting, please, something that dissolves in water, doctor. So that's important to remember. But certainly diet pills themselves, a lot of them, depending on the ingredients, can lead to indigestion and reflux disease.
Well, should we be taking pills with food then?
Normally, depending on what medication you're taking, for example. So, when you're taking an antacid, we normally recommend people take that on an empty tummy or at night time. When you're taking antibiotics, for example, we always recommend taking it just after food because of how it's absorbed and how the enzymes in the liver actually act upon the drug to modify it for absorption so it can be effective. So that's also important to keep in mind.
So listen to your doctor and your pharmacist. They know what they're talking
about. And
if
they don't tell you, ask them when exactly should I be taking these tablets, because simple tablets like steroids or prednisone, which we use for inflammation and we use for asthma, for example, are often taken at night time, and then the poor patient suffers with a bit of palpitations and keeps them awake at night. So please make sure you know exactly when to take your tablets.